Hi, everyone, and welcome to our monthly research briefing. I'm Vanessa Weisberg from the Celiac program at Boston Children's Hospital. And this month, we're talking about a study looking at diagnosis rates of celiac disease in children in different socioeconomic groups. As usual, we have our Director of Research, Dr. Jocelyn Sylvester, here to answer lots of questions on this topic. So let's not bury the lead. This particular study found that although diagnosis rates have improved over the last 12 years, that 83 to 91% of children remain undiagnosed. Why is this?
So that's a great question. And I think there's lots of reasons. And as I frequently say in clinic, the number one reason is like any other diagnosis, but sometimes even more so. If you don't think of celiac disease, then you might not order the appropriate testing and you're not going to make the diagnosis. So I think there's no substitute for awareness. And I'm continually astounded how quickly some of our referring pediatricians get to a diagnosis of celiac disease, because it's not always easy and it's not always the first thing that comes to mind, particularly for kids who present atypically.
Great. So the authors say that socioeconomically deprived children are more likely to be underdiagnosed with celiac disease. Why is this?
So it's an interesting question. And I think there's a few different ways of thinking about this. And we don't know for sure, but certainly in this study where they looked at diagnoses in England, they found that there is a clear correlation. And I think overall, we know that having less resources means less resources in terms of time as well, which means less ability to access resources such as healthcare. This is an interesting study because it was conducted in the UK, where the health insurance system is much different. And so the cost of actually accessing the care would not be the barrier it would be expected to be in the United States. So this is more of a reflection of being under-resourced is not just about money, it's about time, it's about food, it's about housing, it's about everything.
For sure. So how do you think that we can fix the problem and help kids in these communities get diagnosed?
That's a great question, and one that these researchers really didn't address in the design of their study. But I think once again, it's making sure that practitioners who serve these communities are aware of celiac disease, because awareness is key. And also that families are aware to think about it, because often it's the families that bring the child and not the pediatrician that gets the child to come in. So I think it's partly awareness, bringing the kid in, thinking about the diagnosis. And I think that it's also important to remember that we don't really understand what underlies the development of celiac disease. And there are some studies also from Europe where they looked at a population where the genetics were similar, but the social conditions were not. And looking in a region of Finland, right adjacent to a region of Russia, there was a very different prevalence of celiac disease. And they thought that that was more related to the living conditions. And so I think it's important to remember that being socioeconomically disadvantaged is a proxy for lots of things. And these may drive not only seeking out a diagnosis, but for something like celiac disease, where there's a trigger, they may actually have less exposure to what the trigger is.
Absolutely. So the paper mentions the potential use of finger prick screening tests for children at school. Can you tell our listeners about the finger prick test and how it could work?
Yeah, this is actually a really cool idea. So the primary screening test for celiac disease looks for antibodies to tissue transglutaminase. And tissue transglutaminase is in the intestine. It's also in red blood cells. And so one of the biggest components of blood is red blood cells. And so when you take a finger prick, you have liquid, and floating in that liquid, you have red blood cells. Inside those red blood cells, you have TTG. And so what the finger prick tests do is they collect a small amount of blood, they break up the red blood cells to expose the TTG, and then they look for a reaction to the TTG. And if there's a reaction to the TTG, then it suggests there's an antibody. There's no reaction, it suggests there's no antibody. So it's a very clever way to take advantage of what the body naturally has in order to develop a diagnostic test.
And so this is something that a school nurse could do in the school setting?
Yeah, so the problem with these tests is, of course, the accuracy because you're relying on some extra steps when you have to break the red blood cells in order to get something for the TTG to stick to versus looking at the TTG directly, and also variability. But these assays these tests in different places have also been marketed to the general public.
Great. So how can our listeners help with increasing awareness of celiac disease in their communities?
So I think one of the things that's important is that often people remember things if they are related to people who are related to them. So I think it's important that people with celiac disease don't try and shrink into the background, but make sure that people are aware of the relationship between gluten and celiac disease and why they're asking for the foods they're asking for. And often people will get tested for celiac disease because they hear about somebody else's experience and they wonder if that's the condition they have. So I think talking about things increases awareness, and that's the first step.
Great. Well, thank you so much, Dr. Sylvester, for taking the time to explain this research to all of our patient families. We really hope that everyone enjoyed this month's briefing, and we will see you again next month.